Welcome to the R. Adams Cowley Shock Trauma Center at the University of Maryland. My name is George Doetsch, and I'm the chairman of Apple Ford in Lincoln in Columbia, Maryland. I have been a supporter of shock trauma for nearly 2 decades. I was born and raised in Maryland, where I own several businesses in this state. I've always had an interest in the medical field, though it is not my chosen profession. I'm a strong advocate of ensuring the highest quality of medical care for our community. This has been an essential part of my corporate giving philosophy for as long as I can remember. I began my affiliation with the University of Maryland medical system through the Shock Trauma Board of Visitors as a board member and also as vice chairman. A close friend of mine was involved in a severe automobile accident which nearly claimed her life. The superior life-saving initiatives of the shock trauma team and other first responders saved her life. Her story is nothing short of miraculous, but it is surprisingly not unique. I quickly learned that the trauma medicine is different from emergency medicine. The cases are profoundly more severe, and without the advanced training, specialized rescue, and medical equipment, and practice trauma team coordination, most patients would not survive their traumatic ordeal. The Shock Trauma Center sets the benchmark for patient care with a 97% survival rate. Over the next few years, I attended several shock trauma galas, which are the institution's primary fundraising vehicle. This is where I learned more about the golden hour, the critical first 60 minutes when the life or death hangs by a thread. I heard the heroic stories of people who had undergone some of the most horrific injuries ever imagined and survived despite an overwhelming odds against them, all due to the impressive work of the trauma team. I became involved with the mission of shock trauma at a deeper level at that point, coming to understand this golden hour and the supreme medical expertise needed to pull these miracles off each and every day comes at a price. I wanted to do more, so I enlisted the talents of my family and business associates to design and implement a series of annual fundraisers, which we called the Drive to Survive. Each year, we identified a specific piece of equipment on the shock trauma wish list and worked closely with a philanthropic department in a fundraising goal in order to purchase a particular item or fund a specific program identified by the institution. Our initiatives were very successful, and we raised in excess of $1 million for shock trauma. To this day, my family, friends, and business associates are all actively involved in supporting the life-saving services provided at this hospital. I have told you all about my philanthropic involvement with shock trauma, but not my complete story. Perhaps the most ironic thing of all is that my life was saved here at Shock Trauma in 2005. In all my years of association with this institution, I never had hoped, imagined, or even thought for one moment that I would require the services of the Trauma Center myself. I own a thoroughbred horse farm in Harry County, and I frequently ride my horses. On one particular afternoon, I met with misfortune and suffered a head trauma while riding one of my horses. I was airlifted to shock trauma, where upon recovering consciousness, I was met by my longtime friend and associate, Dr. Tom Scalea. He asked me what I was doing here, and I asked him the same thing. We can laugh about it now, but at the same time, he certainly did not expect to see one of his board members on the helipad arriving at shock trauma. I quickly recovered from my horseback riding accident with only minor injuries, and I was released to return home. Unfortunately, due to unforeseen medical complications from my head injury, I suffered a severe stroke when a blood clot traveled through my body and lodged in the left side of my brain. This happened about 10 days after my accident. I was transported back to shock trauma, this time by ambulance, and I woke from a coma several days later. I had arrived at shock trauma in very bad shape. I was told by the physician attending to me, my friend Dr. Clifford Turin, that I had to be revived by him through CPR. Fortunately, I have no recollection of the details. I just know that without shock trauma and the team that saved my life, I would not be here today. What I do recall clearly was awakening once again to shock trauma and again talking with Dr. Scalea. This time the prognosis was less hopeful. I was told that I might never walk or talk again, or worse, I was still at risk for another stroke. The next days and weeks would be difficult. I knew I was not out of the woods, but I had a reassuring sense of calmness and trust, knowing that I was in the very best care in the very best trauma center in the United States, maybe even the world. My recovery was not easy. It took me time to learn to walk and talk again, and to recover all of the skills I had lost before my stroke. Here I am today telling you my own personal story in my own words, serving as a living testimony of the golden standard of care delivered here at Shock Trauma. I can only imagine how many people have come through these doors since my time here. I know the fear and uncertainty that you may be feeling. I have been there and I have lived through it myself. I have friends who have been patients here too, and my own mother received care in this medical center. Shock trauma has been a profound impact on my life. I can only offer you my personal testimony that you will, without any doubt, receive the best of all possible care here. I have continued my legacy of giving to this medical institution as expressed on this heroic gifts wall and through my ongoing involvement with the Board of Visitors, through continuous sponsorships of fundraising activities, and by my personal advocacy of the University of Maryland medical system. I will continue to encourage people to support the life-giving initiative of shock trauma because, like me, you never know when you might find yourself or a family member here in a critical situation with the minutes passing of that golden hour. I hope that trauma never touches your family, but if it has, this is a critical care facility where you want to be, without a doubt. I am fortunate to be a survivor, and I'm honored to share with you my story. I salute all of the men and women engaged in saving lives here every day.